You know what else happens that drives me crazy? I could go off on this topic.
Let's go on. So we always end the Beauty Outlaw with champagne.
Oh, heck yeah.
We're going there.
We're going to go there.
Welcome, everybody, to the Beauty Outlaw podcast.
Hi, everybody. Welcome to an exciting episode of the Beauty Outlaw. Today, we're going to be talking to Dr. Brandyn Dunn, who is a double board certified plastic surgeon. And I would like to call him a friend. I am excited to break everything down. We're going to talk about things today like the SMAS, why that's important to you, and why you should know as a patient what that is, and why it's important to know that the only people that can really restructure that is a deep plane facial. Deep plane facelift.
Yeah,
thank you.
Definitely.
I wished a facial could do it because I would be a millionaire.
I would not need it anymore.
But first, I want you to tell us your story, Dr. Brandyn Dunn. I'm going to call him Brandyn for the show. Tell me a little bit. Tell the people watching where you grew up, where you're from, what you're doing now, all the stuff.
Okay. Well, thank you so much for having me. I'm very excited. And yes, I would also call us friends. So I'm excited to do this. And I think it's really important. You know, I've been following your podcast for a while, and you have a lot of really cool, people that come on and talk about really innovative things and really interesting things within this industry. And surgery, I haven't seen any on surgery.
Yeah,
so
right.
I'm excited to be, one of the representatives of the surgery side. I think we're in the golden age of facelift surgery. So it's kind of a cool time to be talking about this, to be discussing this. And there's so much advancements in this field that it's really fascinating. So I appreciate that. My name is Brandyn Dunn. I'm a double board certified facial plastic surgeon, and I specialize in aging face. So my bread and butter is face and neck lift surgery. So facial rejuvenation, improving facial aesthetics, just making faces look natural. I don't really subscribe to the kind of overpulled, overdone, not really normal looking kind of aesthetic.
Right.
And, everyone has their own taste and opinion, and that's what makes the world go around. But that's just not really my MO. I grew up in California, but I spent most of my formative years in Hawaii. And so if you were to ask me where I call home, Hawaii is my home. And so I go back there. I try to go back at least once or twice a year. I love it. My dad still lives out there. It's kind of where I became so in love with natural beauty. And so it's Hawaii
That would
is
make
the
sense.
essence of that. And not overdoing it, it's just it wasn't. Anyway, and then, so I did my training. I did medical school in Hawaii. I did my residency at the University of Irvine in California, and that's where I met my wife, and that's why we're here.
Who's a nurse?
Yes, she is a nurse. She said, my family lives here, so we're going to be staying here. And you figure it out.
I love it. That's right.
So we figured it out. I went to the Midwest for fellowship, and fantastic experience. Had a full breadth of experience in all facial aesthetics, facial reconstruction, skin cancer reconstruction, facial trauma, facial injury, bunch of facelifts, rhinoplasty. So great experience.
You dealt with a lot more of, a facial board certified plastic surgeon that specializes in face is dealing with lots of traumatic issues, right? Cancer.
Yep.
Restructuring the skin from cancer, grafting.
Yep.
Can you tell us a little bit about why you chose to get into this?
Yeah.
In the first place?
Super interesting because, the field of plastic surgery is very broad. There's general plastic surgery, which is plastic surgery residency, where they do the full body reconstructive, breast, body, tummy, and face as well. And then I took a different route, and a lot of facial plastic surgeons is a specific route. Mm-hmm. And so our background is in head neck surgery. So we do head neck surgery for 5 years. And so we're specialists in this area. We do surgery from basically the skin down to the bones, and which is basically down to the skull base, into the brain, down to the spine, those types of things, and down to the clavicle. So this area of anatomy is kind of just what we do all the time. And reconstruction is where you start. And so we do big head and neck cancer reconstructions, thyroid cancer, parotid surgery. We see the facial nerve from very, very early on in our training. And so it's not something that scares us, I would say. And so, there's a huge gamut of like fantastic plastic surgeons, but our bread and butter is face and neck. And so that's why we're kind of the face and neck people.
Yes.
Yeah.
And I feel like that's why it's important to know what you're looking for when you're shopping around for a facelift, is to know what your provider's history is, and that this is really important certification, more licensure.
Yes.
Then you have to be a part of 2 different boards.
Exactly.
And be board certified.
Correct.
And that's probably not easy.
Yeah.
No,
it's not easy.
Not that we're going to talk about how young you are or how old you are,
but
you're pretty impressive because you are in your 30s, I imagine.
Yeah.
And
not for long.
Not for long. He's almost turning, but that is really admirable. And you're going to go places. You've got lots of time to do lots more surgeries, and we get to follow you and be part of it. What is your favorite procedure to do? If you had one you could do all day, what would it be?
Yeah, I think the deep plane face and neck lift is it. And the reason why it's so, I say this, people may think it's weird, but why it's so cool is because the anatomy, I loved anatomy of this area. I really liked head and neck cancer. And so I got to see the anatomy from like I said, skin to bones, basically. Yeah. And it allows us to sort of see big open anatomy, really complex structures, and then get a functional improvement and like a significant result. And it's awesome. And one of the things that I would say is kind of like my specialty, and I think that I really pride myself in, is really getting dramatic neck and jawline. So I say natural results because I think that's super important, but no one looks bad with a nice neck and jawline. And so that's like, I think that's what I like to specialize in. And I think it comes down to understanding the anatomy really, really well to be able to get that.
Absolutely. Yeah. So that's a little bit about what I want to explain. I know I've got a lot of providers that listen to this too, a lot of injectors, but it's one thing in aesthetics, we need to honor the SMAS.
Yes.
Now the SMAS, if I remember the long word, it's let's see. It is the superficial muscular aponeurotic system.
Aponeurotic system. Yeah, exactly.
Yay!
Yeah,
that's the SMAS.
Yeah. Yes.
And how I try to explain it to people is it's like your couch and the mattress on your couch and your whole couch. And the material is the skin of your face, and the cushion is your nice fat underneath
subcutaneous
your skin.
fat.
Yep. And the ground is your bone, which is what the couch sits on. But the structure and the foundation is your SMAS.
Yes.
And there's nothing that we can do in aesthetics to change that structure and put new springs in. It really takes the restructuring and movement and tension given back by a plastic surgeon doing a deep plane facial. Am I right?
Yeah,
or
exactly.
Deep plane facelift.
Yeah, exactly. We're back doing facials. Yeah, exactly.
So I know that in aesthetics and injectables, that's an area we stay away from, and we go in blind. So we hope we don't get in that space. But what is the difference between 15 years ago when this deep plane didn't exist and now? What were they doing before?
Well, I'm glad you asked. It's actually interesting because 15 years ago, it did exist. The deep plane has been around for a while, actually. I think it was maybe not as well understood. And I think what's different now is that as an industry, as facelift surgeons, so number one, Instagram and social media is holding all of us so accountable. All of our results are just for everyone to see. And we all critique our own results. And so we all are constantly pushing kind of our boundaries to try to improve and get more natural and better looking results. So that's one. And the other thing is we're collaborating so much more. People are sharing their techniques and styles. And there's a lot of like giants in this industry that are so generous. And they've trained a lot of, not necessarily individually, but have shared their experience. And so the field has been dramatically improved. So deep plane facelift has been around, but there's like nuances of it that has changed. I think what you're getting at is that, people previously were doing skin only or just SMAS tightening procedures where it's either a plication or an imbrication, which is basically lifting up the skin, identifying the SMAS, which is that layer, the superficial muscular aponeurotic layer, which is basically, it's a glide plane within the face. It is the layer of tissue that essentially will like slide and that ultimately falls. And that allows us to tighten that layer. It is also a layer that is safe to tighten. So that's why we tighten it, is we're not pulling on some random tissue. It's that tissue that we're pulling on and resetting that is the SMAS. And so a SMAS lift, which is a little bit of a more, I guess less downtime mini facelift technique, is just kind of tightening that layer. So it's just basically putting stitches in it and just pulling on it. But the difference between that and a deep plane facelift is that a deep plane facelift is going underneath that layer, looking at the scary stuff that people talk about, the nerves, the muscles, and all the important structures that are deep to the SMAS, and releasing ligaments, or it's not entirely ligaments, but they're tension points within the face. And so if you don't release those tension points, then you're essentially pulling on something like a stick that's in the ground, and you're pulling on that, and it's not like under no tension, right? There's still like a point of fixation. And so when you release that, then the lift looks more natural. It will last longer. Exactly. And so it's that's kind of the crux of it. But I will say one thing that's very interesting is not every deep plane facelift is the same. So that, not to confuse everyone, but really like it's the same. Not every person that injects filler is the same, or, neurotoxin is the same. Right. And so the amount of dissection that occurs, or the amount of tension, or like how tight they tighten their suture. So there's a lot of nuances. It's not an interchangeable. It's not like buying a Porsche or a Ferrari. It's not like you're going to get the exact same thing in every place. Yeah.
Just because you ordered it doesn't mean it's coming that way.
Exactly.
It is in the provider's nuances.
Yes.
As well.
Definitely.
And their level of training, I guess, education and willingness to, whether they're conservative.
Yes.
So knowing that you're on the same page, I think, when you have a consult is really important. Like you've just said, you like natural. You don't want to go beyond that. Right. So when you have a client or a patient that you consult with, I'm sure you can both identify whether 100%. You're a match or not.
Yep.
Right.
100%. Yeah. We're both interviewing each other.
Yes, we're both exactly. Yeah. So how do you deal with that though, with your consultations? Because we deal with a lot of information,
of course,
out there on everywhere on social media, which is good. Because people come in with questions, and
Definitely.
I love
informed questions.
Yep. And I actually was with one of my mentors the other day, and she had somebody coming at her with ChatGPT craziness, right?
Exactly.
And she said, "I love an informed patient, and I love that you're coming to me because you are going to be really good at compliance and follow through."
Yeah.
And I thought that was a great perspective.
It's true. It's true.
So how do you deal with those viral I wants?
Yeah.
And say no.
Yeah. Well, like I said, I think we're both interviewing each other. And I think it's so important that, we are a good fit, because it's not like we build this relationship forever. And frequently these patients will they feel like friends because I see them so much. And so I want to make sure that, we are on the same page and that our goals align. And this is surgery, and this is the human body, and this is not like going to Home Depot and buying a piece of wood, and you can buy that perfect piece of wood. Like, we get what we get, the life that we live, the exposures that we've had, all of the different, the tissue that you have in your face is the tissue that we're working with, and we can't, change that necessarily. So people that have realistic expectations understand that an 80 to 90% improvement is a win in this field. It's not 100%. If you're expecting 100%, you're going to be disappointed anywhere you go. So I take the consultation very seriously. I talk with them. I go education forward. I'm very education forward in my content and everything I do. But in a consultation, I want to give my prospective patients the information to make an informed decision. So I explain, based on your anatomy, based on your concerns, based on what you're looking at, based on what I see, this is what I think would give you the best, most natural result. And then we come up with a game plan. And, you can do things a la carte, you can do things all at once. And some people will do it however it fits into their life, their finances, their downtime, all of those different things. So there's a lot
involved.
So much.
Okay, everybody, a shout out to my favorite product ever. It's called Lucinergy from New BioAge. Why I like it is because it has resveratrol in it, B6, and something called leucine, a low enough dose to mimic exercise. I take 2 in the morning, I take 2 in the afternoon, and it hits all those longevity pathways. It helps push your natural NAD+. And I know you've all heard about this, so stop taking NAD directly. You want to incentivize your NAD so it goes down the right pathway so you can live long, healthy, and strong. Thanks, New BioAge.
So much involved.
A lot, and also their health.
Yes.
Right?
Yes,
Do they smoke?
Yes.
Yes. Autoimmune.
Definitely.
Can someone have can they be a candidate with an autoimmune disease? Does it depend on what it is?
It does depend on what it is. It also depends on when the most recent flare was, how well it's controlled. It takes a partnership with also whoever's managing that for them. So if they have a rheumatologist or they have a primary care doctor that's managing it, and it's well controlled, and they had a flare one time 20 years ago, not a problem. But if they constantly have flares and there are certain triggers, stress in life, trauma to certain tissues that can cause flares, then it's maybe not the best move. So it is extremely variable depending on what autoimmune disorder.
But it's not a
it
no.
Is. It's not a no.
It's not
Same
a
with
no.
smoking is not a no.
Right.
Yes.
It's not a no.
It's not a no.
It's a timeout for a lot of people, right?
It's a partnership. Yeah.
And a partnership. So sometimes those people are asked to quit for several weeks, maybe a month.
Yes.
If they can, on
4 to 6.
medications to help them. Yeah. And then afterwards, because it really does disrupt the healing of the tissue, right?
Yep. Nicotine impairs blood flow. Blood flow is necessary for healing, oxygenation, all of those different things. And so if you're impairing that, then skin cannot heal as well. It does cause me to sort of change my approach a little bit. And so I won't say that I operated on a lot of smoking patients, but I've operated on enough to kind of understand. Sometimes it's kind of wild, not promoting it, but sometimes I even heal better than other patients. So I don't know why. You never know. Again, back to the human body. It's the human body.
What about the use of growth peptides?
You're the expert in that one.
While you're having a facelift, I would think that you would probably, or their primary care would approve them, right, for the surgery.
Yes, 100%.
Probably wouldn't want to do those while take a pause, most likely.
Yeah,
except for a GLP-1, they need to pause before the surgery, though.
2 weeks, at least 2 weeks before, and that's from a safety perspective for anesthesia. But let's talk about that because I think that's super important. And that's probably one of the most important things in maintenance of your results after a facelift. So weight, as I tell every single one of my patients, I don't necessarily care what the number is. All I care is that it's a healthy weight that you can maintain. Mm-hmm. Everyone has a different weight that's healthy for them. And I think it's super important that it's something that you can maintain because I'll explain this, that some people, if they put on 5 pounds or lose 5 pounds, they lose it in their face. Some people, they lose it in their hips. Sometimes they lose it in their belly. Whatever it is, however you're going to lose that weight or gain that weight, it will go to that area again and it can stress the result. So what you were describing before about the SMAS, I think is really important. I use a different description, but I use a fitted sheet. So I say I create a fitted sheet for your face at the day of surgery. So that day of surgery, I tailor everything so it's like perfectly fitted for your face. So let's say you have a queen size bed. Your face is a queen size bed. We create that fitted sheet. It fits perfectly for a queen. And let's say you put on some extra weight and now it becomes a king. So now put a queen size fitted sheet onto a king bed. It just doesn't fit right. Or put a queen size fitted sheet onto a twin bed. And now it really is like bunching up in all these places, laxity, looseness. And so your results don't maintain. So it's really important to maintain your weight before and after.
It's not like gastric bypass surgery.
Correct.
Where you're trying to shrink down as lose as much weight as you can to have it done.
Yes.
This is really a space where you need to be happy,
Yes.
healthy, and comfortable with who you are
100%.
and want some fine tuning.
Yes.
Right?
Exactly. Yes.
That's what
yes.
that's when you come in. You come into fine tuning, which I love, and I will be considering.
Yeah. You know where to find me.
I know.
Yeah.
I know. We could do like an episode where you give me a consult.
Yeah.
That would be great.
That'd be fun.
It would really help people understand what that's all about. And what you're seeing is so detailed. It's so much more than what we see when we look in the mirror. Face tape is very popular right now, isn't it?
Yeah.
So where would you specifically place the face tape so that you didn't have crinkles? Would you do it here? Would you do it here? How would you place the face tape?
I mean,
This is a plastic surgeon question asking about cheap face tape.
Come into my office. Come to my office.
You'll tape me up before I go out. I love it. He's
Yeah.
going to tape me up. Okay,
Yeah.
moving on to the really interesting thing. So we talked about GLP-1s. We talked about pausing certain peptides, or maybe most of them while you're on this journey of surgery, any surgery, really.
Yeah, definitely.
Health, and be honest with your provider.
100%.
I know that we're getting a lot of these modalities on sources online, and we're taking things, but even nutraceuticals need to be talked to with your provider because they can make a difference
Yep.
in your healing, and that we want good healing outcomes in the world of aesthetics for sure. What about your thoughts on Sculptra
Oh, nice.
and threads?
Okay.
Does that really is that a bad thing and you just hate it? Or is it okay because you can identify it when you're doing a deep plane facelift?
That's a good question. So it's a hot topic.
Yeah.
Let me take one step back because I think it's important to kind of lay the framework for both sides, because I think it's not that simple. All non-surgical treatments introduce some variability or variable of scar tissue. And scar tissue does make surgery more complicated. Does it make surgery impossible? No. Does it make surgery higher risk? It can. But there's so many factors. One, it depends on when it was done. So Sculptra and threads are the two that you brought up, but there's even filler or any sort of procedures that could be done can theoretically introduce scar tissue because that's what it's doing, which stimulates collagen. But it depends on the timeline. So if it was done really recently, then the likelihood that the scar tissue is going to be more robust and more obvious and make the surgery more complicated is higher. If it was done a year or two ago, then it's probably not going to be as big of a deal. Most of these things kind of begin to break down and soften up and become normal tissue after about a year or two. So timeline is important. The other thing that's important is the provider, the person
Placement,
that's doing
right?
it. Exactly. So does someone know what the SMAS, like the depth of the SMAS? Does someone know where the subcutaneous is? So some people know where the dermis is and all of these different nuances of that. If you don't, or you're going to someone that's new or whatever, it could be placed in the wrong field, and that means it's going to be a higher likelihood that we will run into it during surgery. But yes, I mean, in this day and age, everyone's going to have something introduced into their face, and there's going to be complexity. Does that mean, so that means there are places during surgery where we can go faster and things are safer, and there are certain components of surgery that we need to go much slower and just take our time and identify these things if it's around there. So yeah, I think it's fine to do these things. I think, again, being honest with your provider, making sure that you've got a good timeline, going to someone that has experience, that knows what they're doing and is doing it in the right spot. And then you're set up for success. The other thing I will say is that these procedures are becoming so expensive, right? It's a very expensive, everything's expensive now, but specifically facelifts are very expensive. And so I think one of the reasons why there's so much like buzz around this is like the margin of error in surgery is very high, right? Like if there's any amount of error, if there's nerve damage, if there's skin necrosis, if there's dimpling, or if there's any issues,
all risks,
right? Everyone is in a tizzy and everyone gets upset. And so, you're expecting really incredible results, but, and so if you introduce these complexities into surgery, then you can compromise some of these results. You can. So that's why I think that all happens. So hopefully that makes a little sense.
Yeah, it does. It does. Okay, so it's not really new.
Yeah.
I've known about it for a while, but I would love, because as a tissue expert myself
Yes.
in longevity, I've dealt with skin tissue for a long time, and there's a few procedures that I'm set back and pausing, and one of them is microcoring.
Okay.
And that's where you take the little, and I'll let you explain it. You'll
Yeah.
probably explain it better. Do you where you go in and you remove some tissue?
Yeah. Is there a specific?
Well,
yeah.
what
There's
I'm
a lot of
concerned-
different types that do it. Yeah.
So they just go in, they remove a micro or just a little
and
bitty spot of
small.
skin, so it shrinks together, and it's supposed to take place of a facelift.
That's
and
wild.
Skin shrinking. I know.
Yeah.
And but what do you think? I mean, do you think that can actually cause some fibrosis of the skin?
So, I mean, I know what you're
and-
talking about now. Yeah. So the studies that were done basically identified a size of a core that is small enough to not cause
Recruitment of those types of
and also visible damage to tissue. So there's there's a size that you can get. So if it's a little too big, then now you have noticeable, indentations or scar tissue or whatever. And so they were able to identify how small it has to be able to minimize the chance of these negative outcomes. So fortunately, they haven't come up with anything that's going to get rid of a facelift. So we have quite a bit of job security. But I mean, all of these things have like very valid, like it's very creative ideas.
They're creative.
They're very creative.
They move the needle down. I mean,
it does.
Better things come out of it.
100%. But unfortunately, when you're like really at the forefront of all of this, sometimes you are kind of at risk for like complications or things that are unexpected as these things kind of roll out so quickly, because there's always things rolling out. So microcoring, I don't think the amount of skin that I remove during a facelift compared to the amount of skin that is removed with these microcores is probably night and day. It's like such a small amount of skin. And the other thing is remember, it's not just about the skin. It's about like tightening the skin is only one part of the picture. It's tightening the SMAS underneath and lifting and repositioning. So, I mean, it's like 3 to 5 hours worth of work in a microcore. It just doesn't translate.
It's not a good equivalent to plastic surgery.
Exactly. I think if it was described differently as like, this is going to help do something, it's not a facelift. No. Like it is never going to be a facelift.
There is a big difference between just doing a facelift or having a facelift. Yep. You're limited to what you can do on top of the surface. So I'm sure you add modalities sometimes
100%.
At the same time you do a facelift, or do you like to do those separately?
I think it depends on the person and what their goals are and what their like tolerance is of the healing. Because I do think that adding things on top can make the recovery a little bit longer, more challenging. So I guess what I would say, and one of my good friends and colleagues has said it, and I was like, this is brilliant. But so a facelift is a skin quantity procedure, not a skin quality procedure. So the amount of skin that you have on your face and your neck decreases with a facelift, but the quality of the skin does not change. So you still have to treat skin quality. And in order to get a good facelift result, you have to improve skin quality. And so that starts with skincare, consistent high quality skincare. That starts with chemical peels, that starts with lasers, that starts with microneedling. All of those things it's like doing different things. If they're not interchangeable. You can't do one to do the other. Like, so if you want to lift your tissue, then you have a facelift. If you want to reposition things, you have a facelift. If you want to improve your skin quality, then you do these other things that we talk about.
Is there a problem with inflammation if you're doing both? Like say you do a CO2 laser at the same time you're doing a deep plane facelift. Would there be that stretching, the inflammation? Would it cause more, what would that be, tension? Where the excision
you
is,
do increase the amount of swelling, but I don't think it's significant enough to change the result. So I think it's still worth it to do it if you're tolerant to being a little bit more swollen. Because the way I describe it is you're working on the deeper structures and you're working on the top layer, and so you're going to have more swelling. You're going to have more inflammation to that layer. It just means that your downtime may be a little bit longer. Your skin may be pink a little bit longer. You may have to do a little bit more aftercare stuff,
right?
Like Aquaphor and vinegar soaks and things like that for your skin for for the CO2 laser. So it just makes that part a little bit more complicated. But if you're open to that, you've got a support network, you're looking for those results, you want, like I said, a la carte versus all at once. If you want to do it all at once, do it.
Okay, we're going to wrap it up because he has consults and patients waiting for him. But what I want you to explain to everyone is, what are they looking at? Downtime?
Okay. Downtime is, everyone's different, but 2 to 3 weeks is generally the amount of downtime after a facelift.
And how long out of work? Does it depend on what you do?
100%. Yeah, 100%. When someone comes in, they say, we work from home and we can have the screen off. Beautiful. That's great. Let's do it. So yeah, I would say if you're forward facing, you're facing clients and you're really concerned about being either on camera or, in a courthouse or whatever,
right,
then, you probably want 3 to 4 weeks before you do those types of things. But I'll say, social downtime is generally 2 to 3 weeks. Physical downtime is anywhere from around 4 to 6 weeks. Final results are around 3 to 6 months. Honeymoon period, which is there's still swelling, but things are looking fantastic, is generally 2 to 4 months. Results typically last anywhere from 8 to 15 years, depending on how you maintain your weight, you maintain your aftercare, all of those different things. So it's great. And the goal is not to make you look 10 years younger, 20 years younger,
No.
40 years younger. The goal is to make you look the best at your current age and make you look natural, make you look like yourself.
Yes, make you match your body.
Exactly.
How we walk, our gait.
Yeah. How you feel.
How you feel.
Yeah, exactly.
Your spirit, all that needs to match.
Definitely.
And finding a wonderful physician like you that you can be equally aligned with makes a huge difference. So if you're do you recommend people stay in aftercare, or if they have good family?
If you have a good support, it's fine.
Good support, you can go home afterwards.
Yeah.
That's what I
Definitely. Yeah, definitely.
Or a friend who's a nurse.
Yeah,
will come over and take
exactly.
care.
Exactly. Helps to know
It
someone.
helps. It helps. So, Dr. Brandyn, where can we find you?
So every social media, it's at Dr. Brandyn Dunn. My office is called Coastline Plastic Surgery, and we're in Newport Beach, right outside of Fashion Island. And yeah, we're happy to meet you all. Thanks for having me.
And check him out on his pages. TikTok is great too.
Thank you.
And Instagram, and you can see him with his dogs.
Oh yeah.
He loves his dogs.
I do.
So thank you. And on the end of the Beauty Outlaw, we always do a toast.
Oh, that's so sweet. Wow.
With our little Beauty Outlaw glasses.
Yeah.
So thank you so much for being here. And we're going to have you back where we have more time, because I have a million more questions. And I know I'm going to get questions after this. So we will bring you back. Maybe we'll go to your office and have you do a little zhuzh on me.
That'd be kind of
fun.
fun.
We'll do a little what it looks like behind the scenes of Dr. Brandyn Dunn's office.
Love it.
All right. Thank you all for being here, and join us on the next episode of The Beauty Outlaw.